our goal is to maintain the safety of the consumer or the patient who wants to use Ayurveda for their health. And we will do that by making sure that the BAMS people who come from India go through certain training and do it properly, legally and ethically.
And an Ayurvedic doctor spends thousands of hours in classrooms, in theory, in labs, in clinics, in hospitals, in house surgeonship, in research. And here we have people with less than 500 hours to be granted Ayurvedic degree, which is unacceptable.
Exploring ways of ensuring that Ayurvedic practices have the appropriate levels of clinical research and evidentiary foundations behind them.
We have to recognize people who have had the training, even if it was outside the United States, and to have credibility for Ayurveda. BAMS people give it a lot of credibility.
So I'm going to give you kind of a 360-degree view. The minimum duration for completing BAMS course is 5.5 years full-time, whereas here in US, it is minimally between 1 to 3 years.
In India, they recently opened this World Center for Traditional Medicine, along with WHO in Gujarat, along, of course, with Ayush. So if we look at global Ayurveda, with its connection to Ayush, then BAMS Ayurveda has an even greater importance. And it's kind of the basic foundation standard for long-term programs in Ayurveda.
All of the things that have been said so far, I'm really in awe at how I think everybody seems to be coming together and understanding things and seeing things in a similar way. It's up to all of us to make sure that those traditions are not diluted and to make sure that we try to enforce or uphold these standards as much as we possibly can.
And I wish you all very good luck and hope your efforts will be successful, and it helps our patients who need more other therapies. Ayurveda and yoga both actually can be integrated into the medical curriculum in United States.
Vaidyas who have a BAMS from India do not have that credentialing. And NCCBAM is one organization that will be doing that. I think they deserve to be credentialed and board certified so that they can practice to their highest potential.
This initiative not only empowers the Vaidyas, but it educates the consumers to make well-informed choices and decisions about the healthcare when they're looking for a qualified and an extensively trained Ayurvedic medicine doctor.
Best wishes to our effort and everybody involved, and God willing, we will be able to save the dignity of BAMS and higher qualified professionals, not just for now, but for all future professionals that intend to come overseas here.
But when it comes to the future of the profession, we all have responsibility, because none of us here are doing this for our personal gains.